All right. Good afternoon, everyone, and welcome to GAHE's Leadership Series webinar. I'm Bruce Lloyd, GAHE's Executive Director, and it's my pleasure to introduce GAHE President John Keevan, FACHE Senior Vice President and Hospital President, Wellstar Cobb Hospital. John?
Thanks, Bruce. Good afternoon, everybody. I want to thank you all for being here. It's my honor to welcome you to GAHE's Leadership Series webinar featuring Alan Levine, who's Chairman, President, and Chief Executive Officer of Ballad Health. And he's going to talk to us today about his journey in reimagining rural healthcare. We have a packed agenda, but we'll take just a few minutes for some important chapter announcements, and then we'll move on to our program. I want to start, as always, by thanking our sponsors. We couldn't put on great programs like today without them. Our platinum sponsor, Wellstar Health System. Our gold sponsors are Piedmont Healthcare, Metro Atlanta Ambulance, Vocera, and Sound Physicians. And our silver sponsors, DT Spade, Nagel and Associates, SSR, and Vizia Technologies. I want to remind everybody to mark your calendar for our monthly meetings. They're every third Thursday of the month. We have some upcoming events. GAHE is a community partner for the Georgia Hymns Annual Conference, which is on May 3rd at Cobb Galleria from 8 a.m. to 6 p.m., which offers 10 hours of qualified credits. A lot of work going into that. Will be a great event. I want to also remind you that on May 19th, you can join GAHE at Maggiano's from 11:30 to 2 for our monthly in-person lunch and learn. The topic in May is leading a successful multi-generational organization. And it will give you qualify you for 1.5 hours of ACHE face-to-face credit. So if you need that for your fellowship advancement, we encourage you to come be part of it. We'll have some networking before and after lunch as well. Great time to connect with leaders from across Georgia. GAHE and Women's and Healthcare's Georgia chapter are also doing a joint networking event at the Braves game on June 12th from noon to 5. We encourage you to join your fellow women healthcare leaders at this inaugural event for the two organizations. It is limited registration of 40 people, so if you're interested, encourage you to sign up quickly to that. You can always visit our events page if you go to www.gahe.org, and you can see details on all these events and how to register. We also offer several ways to stay connected. As a reminder, our website, but also go join our Facebook group, our LinkedIn, or follow us on Twitter for real-time updates. And we want to invite you to get involved. I say this each month, but we want to invite anyone who's interested in serving on one of GAHE's committees. Please contact GAHE for more information. We'd love to get you involved. Today's program offers 1 hour of ACHE qualified credit, which can be self-reported on the ACHE website. So log in and go to your My Learning, and you can register this 1 hour of qualified credit. So now on to our program. It's my pleasure to introduce our speaker, Alan Levine. Again, Chairman, President, and CEO of Ballad Health, which is an integrated health system serving a region of Appalachia, including Northeast Tennessee, Southwest Virginia, Eastern Kentucky, and Western North Carolina. This region is the size of New Hampshire, so it's a large area. In addition to the 21 hospitals in that area, Ballad Health operates the nation's largest accountable care community. It's a tongue twister. Home health, pharmacies, skilled nursing facilities, rehab services, behavioral health, Ballad Ventures, which is an innovation arm focused on investment in emerging services and technologies. It's a wide span. They have $2 billion in annual revenue and employ 14,000 people across that space, including 800 physicians and more than 4 million patient contacts annually. Prior to serving as chairman and CEO, Alan served for more than 25 years as chief executive officer of hospital and health systems, ranging from small rural hospitals to one of the largest public systems in the country. Alan's commitment to public service spans multiple states. Most recently, he served on the healthcare transition team for Virginia's Governor Glenn Youngkin. He chaired or co-chaired the healthcare transitions for governors for Ron DeSantis in Florida, Governor Rick Scott, and Governor Jeb Bush, all in Florida. Alan was appointed by Governor Bill Lee of Tennessee to serve on the Tennessee Charter School Commission. Alan also served on Louisiana Governor Bobby Jindal's cabinet as Secretary of Louisiana's Department of Health and Hospital as Governor Jindal's Senior Health Policy Advisor. He served as Deputy Chief of Staff to Senior Health Policy Advisor to Jeb Bush. Prior to being appointed by Governor Bush to serve as Secretary, he was responsible for administering a $17 billion budget. So fascinating background around the political sector. But in these roles, Alan oversaw the healthcare response to 12 major hurricanes. And if you've been through the response to a single hurricane, 12 is quite a large ask, making landfall between Florida and Louisiana. He also managed Louisiana's response to H1N1 pandemic and their effort to improve child immunization rates from 48th in the country to 2nd, successfully advocating the passage of major historic healthcare reforms in both states, and was recognized for his effort in combating fraud and abuse in the public healthcare sectors. Alan received his bachelor's degree in health sciences, a master's degree in business administration, and a master's degree in health sciences from the University of Florida, where he is recognized as a member of the University of Florida Hall of Fame. No surprise based on the background here. He is married to his wife, Laura, who is a nurse, so healthcare runs in the family, and 2 grown children. Both also have careers in healthcare. So Alan, thank you for joining us today. I'm excited to learn from you. Quite a background, and I'm going to turn it over to you. Oh, Alan, you're on mute.
It's great to be with you, John. I particularly when I was asked to do this, I was excited about it because I grew up in Atlanta, Georgia, in Sandy Springs. I went to Riverwood High School. I was born in one of Wellstar's hospitals now, what was Atlanta Medical Center. At the time, it was Georgia Baptist when I was born. But it's good to be with you and to share sort of my journey. I know that the title is Reimagining Rural Healthcare, and I'll tell a little bit about the story about how Ballad Health came to be in a few minutes, but I think maybe it's probably better for me to start with sort of my own journey. I know that a lot of this is a topic about leadership and helping everybody sort of develop in their roles as healthcare leaders, during which really is a challenging time, I think, in healthcare. I think all of us know what we've been through in the last 2 years. I think we know now what lies ahead with the labor shortages and challenges that we're going to face with the labor market. And so I think maybe taking a step back, I started healthcare when I was 5 years old. An event occurred, I think, which is probably true for most of us. Events happen in our lives that change the trajectory of our whole lives. In my case, it was the death of my mother. My mom died when I was 5 years old, and I watched her die actually she had a stroke at the age of 36 years old. The healthcare system wasn't positioned to be able to save her life at the time, but from that moment forward, I always wanted to be a doctor. Chemistry as a freshman at the University of Florida changed my trajectory again. I did not do very well and chose a different path, and that path landed me in healthcare management. And you know, I think the thing about the business that we're in, on the one hand, it's a business. On the other hand, it's a passion, because the things we do, the decisions we make, they have a real impact on people. They're not just numbers or dollars and cents. They're the lives of people and the livelihoods of people. And so what we do is really important. And I encourage everybody to continue to stay on the path, as hard as it might seem at times, and certainly as hard as it's going to be to overcome some of these challenges. Let me tell you a little bit about Ballad Health, and then I'll step back into my journey. Ballad Health was the creation out of necessity, that came out of a merger of 2 health systems that were fierce competitors. Our region of the country in Northeast Tennessee, Southwest Virginia, is very rural. We have some urban pockets, but in Kingsport, Johnson City, and Bristol, Tennessee. But outside of those 3 cities, it's a large rural region with a lot of rural hospitals. We have a children's hospital that, you know, it's very difficult, as you might imagine, to operate a children's hospital in a rural region where you don't have a lot of scale. So as you would have expected back in 2014, one of the two health systems, Wellmont, went up for sale. They had put themselves on the market, and Ballad, at the time, Mountain States, which was my system, we were watching this sort of happen, and we looked at the market and we said, you know, as a rural region where hospital use rates were very high at the time, there were about 126 admissions per thousand. The rest of the country, particularly in urban and suburban areas, use rates were closer to 90 to 100. We knew there was going to be, as we moved towards value-based models, risk-based models, we knew that there would be a decline in inpatient utilization. And our theory at the time was, if Wellmont is sold, then the only way Wellmont's going to be able to sustain its margins is by pricing increases on a per unit basis. As use rates decline, the only way to generate margin is to grow your per unit reimbursement. And as a small rural region with a handful of large employers, you know, I felt like there was a natural ally there in saying, look, maybe there's a better way to do this. As two fierce competitors, we had two level 1 trauma centers 20 miles apart. One city had a level 1 trauma center, so the other one had to have a level 1 trauma center. One city had a level 3 NICU, the other city therefore had to get a level 3 NICU. And you could probably tell from my background, I'm a pretty conservative Republican, but in this particular market, the competition was becoming irrational, and a lot of capital and a lot of money was being wasted creating replication and duplication in an area that made no sense. And so, I mean, let me put it this way. Atlanta has, at least as far as I know, has one level 1 trauma center. Miami, Tampa, Orlando, Nashville, you don't have a region the size of ours with 2 level 1 trauma centers. It's just from a quality standpoint and a cost standpoint, didn't make any sense. So our proposal was, we went to Wellmont and said, how about if we combine and become Ballad, and we eliminate a lot of this unnecessary cost and unnecessary duplication, and reallocate those resources to things that can actually improve the quality of life for this rural region. So in order to do this, you know, by eliminating competition, there's an organization in Washington called the FTC. They have a strong opinion about this, but there is federal law that allows a state what's called it's called state action immunity from federal antitrust. Whereas if a state determines that it's the policy of the state to eliminate competition and instead utilize regulation, and the state actively supervises the resulting entity, then the FTC can't really intervene. So we went to the legislature in Tennessee and we went to legislature in Virginia and got special legislation passed authorizing the elimination of competition. Almost unanimous support, bipartisan support in both legislatures. One was heavily controlled by Democrats and one was heavily controlled by Republicans. In Virginia at the time, the governor was a Democrat, and in Tennessee, the governor was a Republican. Both governors signed on to our legislation, and both attorneys general, one from each party, both signed on to the legislation. And so the bill passed, and then we received state action immunity from federal antitrust. Now, this required us to enter into some agreements with the states about things like, you know, putting price caps in place so that we couldn't increase our pricing by more than what pricing would have gone up had we not merged. We had to commit to some standards for quality to maintain and improve quality. And 4 years in, we've been at this for 4 years now. Every year, the states put out a report articulating whether or not we have met the public benefit requirement of what we call our cooperative agreements with the states. And in all 4 years, the states have said that Ballad has met the commitments. And in fact, we've actually reduced, when we started down this journey, we had about 100,000 discharges a year. We've actually reduced our discharges by 16,000 by entering into risk-based contracts and reducing lower acuity admissions and utilizing lower cost settings for care for lower acuity patients. And one might think that, you know, sacrificing $200 million a year of revenue would have hurt us. It actually, before COVID, we had reduced the cost of healthcare by $200 million a year, but our margins actually improved, largely because we got rewarded through our value-based agreements to reduce the cost of care and improve the quality and the outcomes. And so we demonstrated through scale a few things. Number one, that we could reduce the cost of healthcare. Number two, we could keep all of the rural hospitals around our region open. And in fact, not only did we keep all these rural hospitals open during a period when rural hospitals were closing all over the country, in fact, more than 140 of them have closed, we actually reopened 2 hospitals, one of which had closed about 3 years prior. We just reopened it last July in the middle of the pandemic. And so this is an experiment. Ballad Health is an experiment in how to reimagine rural healthcare, not from the perspective of how do we just make sure the rural hospitals can survive. Our proposal was, we think we can actually improve the quality of life. So for instance, in Greenville, Tennessee, we had 2 rural hospitals. One was owned by Wellmont, one was owned by Mountain States. They were fierce competitors in that small town. Both had lost the cumulative $50 million in the 5 years leading up to the merger that created Ballad Health. Both had about a 30% or lower census. And so it was irrational to have 2 hospitals in that small community trying to stay open. One hospital's bond covenants had been violated. And so it was clear that both hospitals were on their way to financial failure. What we did in that community was, and this is the best possible example of the approach we've taken, rather than have 2 hospitals replicating everything in a community that couldn't support 2 hospitals, we consolidated into one hospital that now is financially solvent. The other hospital we converted to a residential facility for women who are pregnant and who suffer from some form of addiction or homelessness or both. This is obviously a need in a rural region in Appalachia where the opioid epidemic is a problem. And so rather than these women showing up in the emergency department in active child delivery, we said, why don't we give them food security and housing security, help them deal with the addiction, and maybe if there's other issues, if there's literacy issues or workforce training issues, what can we do to help these women so that when their baby is born, the child is much less likely to end up in state foster care and is on a pathway to being kindergarten ready by the time they're age 5, which, by the way, if you're successful with that, that child is more likely to be reading at grade level by the 3rd grade. And if they're reading at grade level by the 3rd grade, they're 4 times more likely to graduate high school, college, or career ready. So we asked ourselves as a healthcare system, what is our role in helping to transform our local and regional economy? And our role is, let's create a pathway for a healthy and improved workforce. And that starts from before the time that child is born. And so we started this program last year. We've already served 200 families in that one program. So and another program we started is called Strong Starts. We deliver almost 7,000 babies a year in our region. And we said, since we're the only place where their babies are delivered, and we have access to interacting with these potential moms, why not do proper assessments to determine what the social determinant issues are? Do we have problems with abuse or neglect or addiction or illiteracy or just there's a whole food security, food insecurity? What are the issues that these moms to be are facing, and are there ways we can lean in as a healthcare system with our partners? And our partners are, you heard mention the accountable care community. We have the largest accountable care community in the country with over 400 partner organizations that we facilitated. So the idea is we identify these women who might need extra assistance, and we hand off to our partners in the accountable care community. And again, the end result should be the same: reducing the number of children that end up in foster care and get them on a pathway to a successful life. Now, I think all of us know if you reduce poverty, then you improve overall health of a community. So this is not a silver bullet initiative. It's not an initiative that in 3 years we're gonna be able to ring the bell and say we've succeeded. This is an initiative that we've got to have 18 to 20 years of consistency. And if we are successful with this, then over time, generationally, we can transform the region by reducing the rates of poverty, by getting more kids graduating high school college or career ready. It's a whole different way to think about all of this, but the value proposition we said is, does it make sense to have 2 level 1 trauma centers in a region that can't support 2 level 1 trauma centers? Here's an example where we did that. We went through, and I think for those of you that are aspiring to be CEOs or may already be CEOs, you'll appreciate what I'm about to say, or hopefully learn from it. When you are a CEO, if you want to be popular, then get a dog. But when you're a CEO and you're making hard business decisions, they are often going to be very unpopular. When we announced that we were consolidating the 2 level 1 trauma centers and consolidating the 2 level 3 NICUs, it engendered a lot of hostility towards Ballad Health and towards me personally, by people in the communities that felt they were losing something. And healthcare, it's so local and so personal. When people feel like they're losing something, it's a fight that they believe is worth fighting. And so we had about a year of folks who protested us, set up a tent in front of one of our hospitals, and actually they had 24/7 presence there protesting the decisions that we made. And it was somewhat hostile, but on the other hand, I also understood the concerns. It's one thing to have people protesting you, and you can certainly fiercely disagree with them, but it's important to actually hear what they're saying, because they're scared and they think they're losing something. Healthcare is that personal. So one of the things that we internally were determined to do was make sure that as we implemented these initiatives, that we achieved the result that we promised we would achieve. With trauma, our mortality rates have decreased by as much as 40% since we consolidated to 2 level 1 trauma center, from 2 level 1 trauma centers to 1. NICU, the level 3 NICU, by consolidating to 1 NICU, we've generated about $15 million of philanthropy. People who've said, I would never have donated, but for the fact that you've now created 1 NICU to serve the whole region in the children's hospital. And so the net result is we're now building a brand new NICU to serve the entire region, and creating a regional center for pediatric specialties. So in a rural region, we have demonstrated that we can keep the rural hospitals and access points open. We've demonstrated that we can eliminate wasteful duplication where we find it. And we've demonstrated that we can find ways where the healthcare system can contribute long-term to the economic vitality of the region. Now, where did I get the ability, the thick skin to be able to go through all of this? I'm proud to say that we've been through all of that and COVID, and our entire senior management team is still intact. And it's been 4 very, very challenging years, but it happened because our management team truly believed in what we were trying to accomplish. And our board, who are people that all live locally, who go to church with the folks who may not have been happy with the decisions we were making, but they believed in what we were doing, and they were advocates for what we were trying to accomplish. I will tell you, my first job as a CEO was in a rural community in Perry, Florida. And my first lesson there, I was meeting with my board chair, and we had an old Hill-Burton hospital. It was an old 48-bed Hill-Burton hospital built in the 1950s. And because of that, the only people that really used the hospital in that rural community were people who had no insurance. People who had insurance, they would get in the car and drive 45 minutes to Tallahassee or to Gainesville, Florida for their care. In my case, I said, well, what would it take for us to re-earn the support of the local residents to support their local rural hospital? Because if we couldn't, there was no way that hospital was going to survive. So we decided to pursue a penny sales tax to do a bond issue to build a brand new hospital. And a lot of people this is a North Florida community that had never voted to impose a sales tax on itself. And I met with a friend of mine who I had terrific insight. He made a comment to me, and to this day, that this remains my favorite proverb, 29:18. We were talking about the importance, and this is a lesson learned. I hope some of y'all can take away from this. Proverb 29:18, it says, without a vision, the people perish. And I was explaining to him that if we didn't do something, then this rural hospital would likely not survive. And he said, Alan, he quoted that proverb. He said, without a vision, the people perish. You have a vision, you have to go communicate your vision. And I will never forget going around to churches and whatnot, and spent a year educating the community on why I told them, if we got the penny sales tax and built the new hospital, that was not a guarantee that the hospital would survive. But if we didn't do this, I could guarantee there would be no hospital. And 72% of the people in that community voted for a penny sales tax, and that hospital was built. And I had the joy, after I was served my time in Perry, that's when I ended up going to work for Governor Bush. Originally, I was his deputy chief of staff. I had the joy of going back to Perry to do the groundbreaking or the ribbon cutting to open that new hospital as the incoming Secretary of Health for the state of Florida. And it was a real joy to see it. And that hospital is still there today, serving that community. So what I would tell all of you is for me, when you're in a position of leadership, having a vision is really important. And that proverb means a lot. Where there is no vision, the people do perish. And so but it's not enough just to have a vision. You've got to have the confidence and the communication skills to be able to lean in and explain to people the why. Why are you trying to do why are you doing what you're trying to do? And it starts with believing in it yourself. If you believe in it yourself and you can explain that vision to other people, people will follow a leader. They may not always agree, but they will follow a leader. And a leader that has a vision and can articulate that vision, it means a lot. I'll tell a couple of stories, and then I'll turn it and open up for questions. I had the honor of serving. I was named Secretary of Healthcare in the state of Florida when it was June of 2004 when I was first named Secretary. A month and a half later, a little storm was moving up the west coast of Florida called Hurricane Charlie, and I was sitting in the briefing room with Governor Bush at the time. And the state meteorologist, we were expecting that hurricane to go all the way up in Tampa Bay, but the state meteorologist came in and said, Governor, the hurricane has changed directions. It's turned east. And the governor said, well, what does that mean? He goes, well, it's going to hit Port Charlotte and cut across the state from Port Charlotte, which is well south of Tampa. And I said, well, when's that going to happen, Ben? His name was Ben. I said, Ben, when's that going to happen? He said, oh, it's happening right now. So we got up and we ran into the briefing room and had a press conference to sort of warn the public. And I'll never forget, during that discussion, my phone was ringing, and I stepped away from the press conference to answer the phone. It was the CEO of a hospital in Port Charlotte who had said that water was pouring down through their electrical outlets, their roof had blown off, and they had 260 patients in the hospital. And you got to know, in emergency response, the way it works, typically, if you need help locally, you go to your local emergency management. If they can't help you, then it gets elevated to the state. And if the state can't help you, it gets elevated to FEMA. Well, all of that was happening real time. And it was evident to me that the process that was in place wasn't effective because things were happening too fast and people were in danger. So we pulled a team together, the National Guard, FEMA and others, and we mobilized 200 ambulances to move from Miami to Port Charlotte. Well, we learned, when ambulances drive 2.5 hours from Miami to Port Charlotte, by the time they get there, they're out of gas, they're out of diesel. And what was going on in Port Charlotte? Well, a hurricane knocked out all the electricity. So there was no way to fill the tanks up. So we had to dispatch tender trucks to fill these ambulances up so we could evacuate these patients. And the real takeaway, and this was, I think most of you experienced this during COVID, no matter what your plans are, they aren't going to work. And what we did here at Ballad during COVID, the advice I gave my emergency operations team here was, if things are going well, then look for the next thing that can go wrong. Never, ever think things are okay or going according to plan, because at some point the wheels are going to fall off. So every day we had meetings to identify what is going to be the next crisis, what is going to be the next problem, and how do we troubleshoot that before it becomes a problem. And that really did help us during the hurricanes. We had 4 back-to-back hurricanes that season. Charlie came and went. At one point during that season, the entire state of Florida was either responding to or preparing for a major hurricane. The next season, we had the same thing, 4 in a row, the next hurricane season in 2005. I moved to Louisiana a few years after that to serve as Secretary of Health in Louisiana. We had 2 major hurricanes there, Hurricanes Gustav and Ike. And then we had the pandemic, the H1N1 pandemic, and then the oil spill. And in every one of those instances, I was exposed to things that I had no knowledge about. And every one of them, it was building an airplane while we were flying it, but it was fundamentally just trying to learn, listen, assess, and recognize that things are definitely going to go wrong. One other quick story that hopefully you could appreciate is when I was in Louisiana, we had an epidemiologist who was advising me during the last pandemic, the H1N1 pandemic. We had a 6th grade girl from Lafayette, Louisiana, who had gone to Mexico with her family, came back, had a slumber party, and the entire 6th grade class at her school was coming down with symptoms that were similar to swine flu. And this was a 1,600 person school. So this was a very big Catholic school in Lafayette, Louisiana. And so I met with our epidemiologist, who said it would take 3 days to diagnose whether or not she had the swine flu. So I closed the school down. The governor and I did a press conference and announced it. And 3 days later, we reassembled the team, and I came and sat down, and the epidemiologist, I looked at him, I said, okay, well, what's the result? He says, well, we don't have the result. I said, what do you mean you don't have the result? You said it would take 3 days. He said, yeah, it would take 3 days from the time we get the sample. I said, well, you haven't gotten the sample yet? He says, no, the sample is still in the doctor's office in Lafayette. Now, keep in mind, Lafayette's 45 minutes by car from Baton Rouge, where we were located. And I said, well, why didn't you go get the sample 3 days ago? He said, well, you don't understand. The way we do surveillance is we have a truck, and the truck circulates around the state and collects samples throughout all corners of the state. And that's how we do our surveillance. And I sat there and I thought, well, that's how we do surveillance when we're not in the middle of a pandemic. But again, the takeaway was, in any situation in leadership, never make assumptions about what your people know. It's okay to test them. It's okay to ask questions and to ask for detailed questions, even if you think you already know the answers. Because whether you're starting a new business line, a new service line, whether you're acquiring a new business, whether you're making a decision about staffing, you might make assumptions about what your team has knowledge about. And a lot of times when you make those assumptions, you could be wrong. And so I always encourage people, get down in the trenches and ask detailed questions, even if you don't necessarily always care what the answer is, just to make sure that your folks that you work with, whom you are relying upon, have thought about those details. Because if they're not thinking about the details, at some point, the fact that no one's thinking about those details is going to come back and bite you as a leader. And you don't get to turn around and blame the people that work for you. You own it. It's your responsibility to own the answer. And so no shortage of times have I had to stand in front of a camera and say, this is my responsibility, even if it wasn't necessarily directly a decision that I had made. And I would end my comments with that one thing, and that is, in a leadership position, I learned long ago that success belongs to the people around me. Failure belongs to me. And I think if that is your philosophy, I think that engenders tremendous loyalty. It helps attract really good people and retain really good people. And at the end of the day, it's a level of humility that I think all leaders should have, because none of us is necessarily the smartest person in the room. In fact, we shouldn't be. If we're good leaders, we should have surrounded ourselves with people that are smarter than we are in many respects. And so I'll conclude my comments with that. I'd be happy to answer any questions you have about any of my experiences, or certainly I'm happy to share other stories John, I'm happy to turn it back over to you, and we'll go from here.
Alan, thank you. That is quite a bit to absorb and think about, the courage you had in so many unique situations. Certainly have some questions I'll jump to myself, but starting with some that have been posted. One is kind of a practical question asked about the board at Ballad. Do you have currently active practicing non-hospital based providers on your board? So do you have physicians on your board that are not hospital-based, community type physicians, I would assume?
We have one of each. We have an anesthesiologist, and we have a physician who actually was practicing until about a year ago, who is the former president of the Tennessee Medical Association, so very active in his profession. One is rolling off. Good governance requires a thoughtful process for board replacement as members roll off. One of our two physicians rolls off in 1 year, and we've actually identified several actively practicing physicians to take his place once he rolls off.
Got it. Thank you. A couple other coming in. Has the consolidation of services at a single site, so trauma, NICU, et cetera, impacted access and travel time for some of your mountainous rural community?
Actually, it's improved. When we were two competing systems, we did not have a single coordinated communication system for the region. When we consolidated the two level 1 trauma centers, we put together a direct communication system. So we have live communication with police, firefighters, and EMS throughout a 21 county region. And so I'll give you an example. About 6 months ago, the police chief in Norton, Virginia, which is about an hour and 20 minutes from our flagship level 1 trauma center, the police chief was shot twice at close range. Within minutes, we had a helicopter service there. He was on the operating room table in Johnson City within about 20 minutes.
Wow.
So we went from having two fragmented level 1 trauma centers to having one level 1 trauma center, two level 3 trauma centers, and a regional coordinated trauma system. So it's enabled us to, and that's why our mortality has actually declined in trauma. So it hasn't really been an issue at all.
Right. You get stabilization done and then get them to a center that's got quality outcomes. Yeah, makes sense.
Correct.
So, CON is always a hot topic in Georgia. I think Tennessee is a CON state. Is that correct?
Yep. Yes.
Are there prospective changes to CON that you would foresee potentially coming? And if so, how would that impact your healthcare system?
I as Secretary of Health in Louisiana, which was not a CON state, my experience there was that a lot of hospitals were built where there was really no need for a hospital. And then what happens is legislators hate to see their hospitals close. So they would come to me and say, what can you do to support this rural hospital? And so that's why Louisiana has the highest Medicaid rates in the country, because we were constantly doing things to try to prop up these hospitals so they wouldn't close. I'm one of those people that believes in the certificate of need process in areas, particularly in areas where you don't have enough critical mass of people to support multiple facilities. And I've experienced this. For example, where you have physician-owned diagnostic centers or surgery centers where they can self-refer, what ends up happening, and the data is pretty clear on this, what ends up happening is magically their commercial payer mix is really high, and the hospital's Medicaid and uninsured payer mix from that patient cohort is really high. And that kind of cherry picking, a large hospital in an urban area might be able to survive that kind of cherry picking, but if you get into a non-urban or rural community, that could be deadly for the hospital, and then the hospitals end up failing. And that's why there's a lot of reasons why you've seen so many rural and non-urban hospitals close in the last 5 to 10 years. And that's one of them. It's the movement towards risk-based models, the decrease in fee-for-service. There's just not enough critical mass of people to support the fixed operating costs of a rural and non-urban hospital. So anything that allows you to cherry pick, I think that's just bad public policy.
Yeah, it's an interesting topic and controversial topic for sure. As I know a lot of states like Tennessee and Georgia, there's a lot of push from some of those that are trying to come in and cherry pick to alleviate the CON requirements. I've worked in various states, Texas, that didn't have one, so I've experienced some of what you're talking about. Thank you for that. One of the interesting things you have that a lot of us don't get to experience is working in multiple states at one time. What are the challenges that you deal with working in multiple states for your system in one time?
Actually, it's actually not too bad. In our contiguous region, Southwest Virginia, Northeast Tennessee, culturally, it's very similar. The one challenge we have is because under state action immunity, Virginia has their mechanism for regulating us and Tennessee has theirs. And so it does create some differences in how each state approaches it. So that life could be a little easier from that perspective, but it's not. I mean, I think both states recognize the contiguous nature of our states and the unique issues in our region. And I think both states do genuinely appreciate the effort that we're making to reach out beyond the walls of the hospital to try to transform on the social determinant side. In this part of the country, this is a part of the country, and from a cultural perspective, this is a part of the country that is very proud and doesn't like to be told what to do. It goes back to before the Civil War. I mean, this is a part of the country where your neighbors down the street were fighting for the Union, and you might have been fighting for the South. I mean, that's how historic the differences can be here. And so when you have three cities like Kingsport, Johnson City, and Bristol, if you make a decision to consolidate a service in Kingsport, Tennessee, in Johnson City, Tennessee, folks in Kingsport aren't very happy about that. And so the bigger challenge isn't the two states. It's really what I call Friday night football. Kingsport, Johnson City, and Bristol are three communities that simply see themselves as very big competitors with each other. And Ballad doesn't see it that way. We are regional, and every decision we make thinking about how does it affect the whole region, not just one city.
Right. So that one of the questions posted was, in a lot of work to improve the social determinants of health, what's the biggest pushback been? And it sounds like this may be it, that it's the pushback of not being told what to do. Our problem isn't the next city's problem, kind of thing, or vice versa. Is that accurate?
Yeah, I think that's really been the biggest issue. I think, in order to invest in dealing with social determinants, we're trying to eliminate cost in other areas. Whenever you're trying to eliminate, I think all of us can appreciate, whenever you're trying to eliminate cost, you have several constituencies that aren't happy about it. Sometimes it's your own employees. Sometimes it's the community that's being affected by those decisions, which gets back to communicating the vision. They may not always agree with it, but if you execute on it, they eventually do see it.
Absolutely. So you've seen that they have come around as it has been executed. That's good to hear, because I know that that's a challenge for all of us, figuring out how do we impact the community beyond the walls of a hospital or skilled nursing facility or whatever it may be, is through those community health programs.
Yeah, John, I'll use when we were going through the trauma issue, and it was a very painful time for everybody, but I used the example of the Cleveland Clinic up in Ohio. The Cleveland Clinic had acquired a hospital on the east side of Cleveland, and they made a decision to consolidate, to close the trauma center in that hospital. And the community went crazy. The city council filed a lawsuit against the Cleveland Clinic to try to prevent it from happening. And eventually Cleveland Clinic just relented and said, fine, we'll keep it open. And then 6 months later, they announced they were closing the entire hospital. So it's, if you really, I think it's, and to me, this is really important. There's a difference between being stubborn for the sake of being stubborn, or believing in what you're doing and having the spine to stand by it while listening to concerns and trying to address concerns. It's important. When we were going through trauma and NICU, we had 100%, we were 100% committed to executing on that. But, when I stood for 2 hours in front of the Kingsport Board of Mayor and Aldermen, they weren't happy about it. and people were throwing darts at me for 2 hours. But at the end of the day, you just, if the facts and the data are on your side and you've done your homework, it's important to stand by your, I mean, it's okay to be firm and committed to something you've decided to do, but also invest in listening. Make sure you make yourself accessible so people have a chance to express their concerns, so they feel like they were heard.
Sure.
In the day of social media, one of the things, and I didn't talk about this during my comments, but in the day of social media, our jobs are even harder, because there's an old saying that the truth gets halfway around the planet before, I'm sorry, a lie gets halfway around the planet before the truth even gets its shoes on.
Yep.
And with social media, that couldn't be more true. And we end up having to change. I mean, my marketing team spends an awful lot of time monitoring social media to make sure that if there's something that's said that's inaccurate, that it's responded to, or if somebody says something on social media about their experience in one of our hospitals, immediately that person will get a direct message, or will get a response from Ballad that says, if you'd like for us to follow up with you, please direct message us and we will follow up on your concern. Because
Sure.
we're no longer in a time where people pick up the phone and call the hospital to complain. They'll just go out on Facebook or social media and do it.
Yep.
And so we just have to adapt to that.
Yep. Absolutely. Well, so this kind of leads into a few questions I'd like to cover. I know we're starting to run short around leadership. And two main ones have kind of come up. One is, you have an interesting career going from, let's call it the non-governmental private sector and rural, to the government sector or public sector, and then back to private. What sort of leadership attributes allowed you to be kind of nimble in your career, versus a lot of us get kind of in a track and stay in it? What do you attribute your success in both of those roles to?
I have to tell you, and this is a skill that you just have to work on developing. Our business is not linear. I mean, we have to have the ability to play three-dimensional chess. We have to understand not just what's in front of us today, but what's coming around the corner. The difference between what I think is a great leader and a great leader knows what's coming. And oftentimes, a great leader is standing by themselves when they're saying, like 6 years ago, I knew that our use rates were going to decline. And I knew if we just did nothing or just kept doing what we were doing, eventually our business model would fail. And at the time when I went and said, our system to sustain its margins, one way is to increase pricing, another way is to cap pricing and decrease our overall cost. And at the time, people said, you want to do what? But once I explained it, the largest employer in the region is Eastman Chemical, which is a Fortune 100 company. Eastman was the biggest advocate for the merger that created Ballad, because they understood the concept of reducing your per unit cost. And they knew if we either our margins were going to increase by raising prices, which is, frankly, that's a business model HCA uses. Large multi-hospital systems, they use leverage to which there's nothing wrong with that. It's a business model. In our situation, we chose a different business model. But I think it's important to hone your skills in playing three-dimensional chess. And I'll tell one other quick story. I learned, sometimes you learn by making really stupid mistakes. I remember when Jeb Bush hired me to be his deputy chief of staff, the reason he asked me to do it was because I was from the private sector, and there were several major things in healthcare he wanted to do during his second term. One of those was to tackle the issue of medical malpractice reform. At the time, Florida had a huge crisis with medical malpractice. Doctors were leaving the state. And so we proposed some very aggressive reforms that included caps on non-economic damages and some other stuff. And of course, the trial lawyers were dead set against us. The House of Representatives was with us. The Republicans in the Senate were not. Our biggest problem getting our reforms passed was that the Republican leadership in the Senate was not in agreement with us. So an old friend of mine from HCA, who had been my boss when I'd worked for HCA, he sent me an email on my state email account saying, hey, Alan, what are we going to do about these senators? They're not helping. And I responded, not thinking that my emails were public record. I responded saying, yeah, here's 5 senators that are a problem. we need to find primaries for all 5 of them. Well, you know, in the 24-hour period in a governor's office is like a week. And so about the next day, I was sitting in the office with Governor Bush, and you know, he was on the phone with somebody, and I was waiting for him to get off the phone so I could brief him on something. So I'm sitting there, you know, kind of casually, and our press secretary comes running in, and she says, "Alan, did you write an email targeting 5 Republican senators for primaries?" And I said, "I don't know what you're talking about." And I didn't remember. And she said, "So you didn't write this email?" And she handed me the paper that had my email on it. And I looked, my heart sank. I looked at her, I said, "Jill, where did you get this from?" She said, CNN, Fox News,
Wow.
Miami Herald, St. Pete Times, every major state and national media outlet had a story that the chief of staff to the governor of Florida, Jeb Bush, was targeting Republicans for primaries. One of those Republicans happened to be the incoming Senate president. So you can only imagine that at that moment, the governor looked at me. He said, "All right, Alan, here's what you got to do. You need to call those 5 senators right now and apologize and make sure that they believe you mean it." And so I called all 5 of them, and I did mean it. I apologized. I felt terrible. And of course, the top story on every news outlet the next day was senior Bush staffer targets Republicans. And so the sort of strange ending to this story was, you know, of course, several of the people in the Senate wanted me fired. The governor was not about to fire me. And in fact, they passed our reforms. So to some degree, it might have actually worked. But the governor then appointed me to be Secretary of Healthcare for Florida, which requires the Senate to confirm me. So it was a weird twist of events where I had to sit in front of those very senators to be confirmed for that appointment. But I learned, you know, one of the lessons learned there, and this is a soft skill, there's no question that you're going to make mistakes in leadership. You know, when you do, be the first to acknowledge it. Just own it and say, "Oh, you know, that's a mistake. I should have done something different." You gain a lot more credibility by owning a mistake than doubling down on a mistake, and then having people think that you don't have the humility to acknowledge that you're human. So anyway, I probably went well beyond answering that question.
No, that is absolutely fascinating and great, just leadership advice. This notion of, you know, I think I always think about a good leader is one who recognizes they've made a mistake and pivots, not one that always makes the right decisions. And so interesting to hear you talk about that. One last question that is on my mind, and I know we've gotten a couple of kind of questions around this. Some of the decisions you made throughout your career were what I would call courageous decisions. And they're ones that could have gone real bad the other way. And I know you talked about creating a sense of purpose and the why behind it to engage people through those difficult decisions. But I'm curious just to hear, what are sort of the soft skills or intentional skills you have to keep both yourself focused during that difficult decision making and keep your team rallied around, hey, this could go bad, but we believe it's the right thing?
Well, I'll start with governance. You know, I serve as the chairman of my board, and every meeting we start the meeting with what we call a mission moment. I would suggest you try this too. I mean, we start with the first thing on our agenda is our mission statement, and we start with a mission moment where we share a story or an event that identifies connectivity with our mission, and it really forces us to remind ourselves before we even say our prayer, what is our mission statement? How does that mission statement apply to decisions we're going to make or that we've made? So I think starting every conversation with reminding everybody what the mission is, because, you know, so many times, how many times do we get into discussions at a granular level, and we sort of forget what the ultimate mission is. I mean, if we're a for-profit and the mission is to maximize value for shareholders, there's nothing wrong with that. Talk about that. How you maximize value for shareholders by offering the best service or reducing your cost. I mean, but in a not-for-profit system where our mission is to honor those we serve by providing the best possible care, we talk about what it means to honor those you serve. If honoring those we serve is the first half of our mission statement, then we try to understand what that means. So when we went through the trauma decision, we knew that there was a lot of negativity related to that. But on the other hand, it doesn't honor the people we serve by doing something, continuing to do something that costs them more, but leads to poorer outcomes.
Right.
And so that's how we tied that back to our mission. The other thing I would say is this, you know, if you can't, you've got to find joy. You have, even during the downtimes, even when things are tough, if things are tough and you're feeling like you're being attacked, you know, God puts every one of us in the position we're in for a reason. We might not know the reason, but man, when things are tough, that's especially when I take joy in what I do, because I consider myself to be somewhat of a joyful warrior. When I was working for the governors and we were fighting for reforms that weren't always popular, I was always very joyful about it. I never took it personally, even when people were attacking me personally. And I tweeted something out this morning. Somebody tweeted something sort of nasty towards me, and I don't respond to negative tweets, but I generally said, look, I think I said something like, I don't understand why folks feel like it's a good idea to come on a social media platform and attack people or insult people. I really don't take, I wish more people could find joy in themselves and in what they're doing, because you don't get joy by tearing other people down.
Right.
You know, and I know I'm venturing outside, but that's, you know, being a leader, you can't disassemble yourself as a leader. As a leader, you are who you are. And if you are naturally somebody that finds joy, the leadership will come easier for you. If it doesn't come easy, if finding joy is not something that comes easy to you, I would argue that's something you should work on, because it will make you a better leader if you're a joyful warrior.
Absolutely well said, Alan. We are right at time, and I think a great way to end it is to challenge everybody to be a joyful warrior heading out from this conversation. This was absolutely fascinating. Can't thank you enough. I think I can speak for everyone in attendance that we all learned here and learned both leadership and just a fascinating series of events that you've gotten to lead through in your career. So thank you for taking the time today. I know you're incredibly busy, but it means a great deal to us that you took time to chat with us today. So thank you for joining us, Alan. And before we wrap up, just a quick thank you to our sponsors. We appreciate all you do to provide leadership for our healthcare industry across Georgia. And as a reminder, please be sure to complete your meeting evaluation forms. We read those. We want to know how we're doing, how we can continue to improve our learning sessions. That will be emailed to you later today. And then be sure, again, to report the 1 hour qualified education credit on the ACHE website. Get your credit after such a great event. And certainly everyone have a great afternoon, and we hope to see you again soon. Alan, again, thank you. And we appreciate you joining us today. Thanks, everybody.